Hi, I'm Jim Duthie, a New Zealand urologist based out of Wellington Public Hospital in Wakefield at Wellington and Bay Urology in Tauranga. My subspecialty interests are robotic prostatectomy for prostate cancer and whole-lip and urolift procedures for benign prostate hyperplasia. The traditional approach that we've had for men with BPH symptoms has been to give them medications for as long as possible before their symptoms get to a point where they require surgery. This is because the traditional procedures of TURP or the laser equivalent whole-lip can come with some significant side effects that men with more mild symptoms are keen to avoid. The problem with this is that we now have increasing evidence that the longer men wait for procedures for their BPH, the more chance there is of them suffering irreversible damage to their bladder, so that when they do finally have their procedure, the outcomes aren't as good as they could have been had they had their procedure earlier. While the TURP and whole-lip procedures are very effective for the right men with BPH, we now have the luxury of an innovative range of procedures for BPH which may be easier for men to take. No procedure is free of side effects, and there are some important factors to consider when choosing your BPH procedure. These include the severity of your symptoms, the importance that you place on your sexual function and fertility, the size of your prostate, and the opportunity to have follow-up procedures in the future should they be needed for either BPH or even prostate cancer. Procedures that destroy or remove prostate tissue may make future prostate cancer surgery more difficult. New does not always mean better in terms of these procedures, and it's important to consider whether an established procedure with a long track record is preferable to a perhaps less well-proven procedure. As always, the most important thing is that you get the right procedure performed by the right surgeon, meaning somebody who is properly trained and experienced in the procedure that they're performing.